Good day, ma'am. I'm Dennis Kate Cabiedes and I will be performing the Fundal massage checklist. So for the first procedure, I will be explaining to the client the necessity for the procedure and also be providing her the privacy. So to provide the privacy, I will be closing the doors and the curtains. Good day, ma'am. I'm Dennis Kate Cabiedes, your nurse for today. So I will be performing fundal massage on which this will stimulate your uterine contraction and also to promote uterine tone and consistency. This will also minimize the risk of hemorrhages or bleeding. So I will be repetitively massaging your abdomen. If you feel any pain or discomfort, just let me know. So the principle for this is that explanation helps decrease anxiety and providing privacy enhances self-esteem. So now I will be asking my patient to void unless bleeding is extensive and more rapid action seems necessary. So ma'am, before we proceed, may I ask you to please urinate first. Then after that, I will be asking my client to lie in supine position. Ma'am, can you please lie flat? And to flex your knees. Ma'am, can you please bend your knees? Thank you, ma'am. Ma'am, I will now be exposing your abdomen. Then I will be observing for my patient's abdomen for contour and to detect distension. Principle for this is that an empty bladder prevents displacement of the uterus and ensures accurate assessment of uterine tone. Proper positioning enhances visualization and effectiveness of the procedure. Now I will be putting on my gloves. Now, I will be placing my one hand just above the symphysis pubis and then the other one hand on the around the top of the fundus. So the principle for this is that this anchors the lower uterine segment and allows you to locate and assess the fundus. Now, I will be palpating the fundus and rotate the upper hand to massage the uterus until firm, being careful not to over-massage. So the principle for this is that massage should be only done when the uterus is not firm, and aggressive massage may lead to partial or complete uterine prolapse. Now, when the uterus is firm, I will now be pressing the fundus between the hands, my hands using slight downward pressure against the lower hand. So, principle for this is that gently squeezing with downward pressure helps to expel blood or clots collected in the uterine cavity. Now, I will be removing and observing my patient's perineum pads for any passage of clots and amount of bleeding. So the principle for this is that this helps to assess the degree of bleeding of my patient. And now I will once again massage the uterus one more time to be certain if it remains firm. Now I will be cleaning the perineum. And then I will apply a clean perineal pad. Then I will be discarding the gloves and the soiled pads according to agency policy. This helps to promote comfort and hygiene while reducing the risk of infection. Now, I will be washing my hands after the procedure. So the principle for this is that this prevents transmission of microorganisms. Then, I will now be documenting the results of the procedure and continue to assess the fundus and lochia according to agency policy. Also, I will be notifying the primary care provider if the fundus does not remain firm or if bleeding continues. So, the rationale for this is that documentation provides a mean for evaluation, and continued assessment allows for early identification and prompt intervention with additional measures such as oxytocin to prevent hemorrhage.